For the next 15 minutes, I shall be giving you a brief overview on the climate change, its impact on healthcare, and what are the challenges specific to India, what are the government initiatives at the moment, what we can learn and implement from the developed world. So the governing bodies for climate change are the United Nations, the Intergovernmental Panel on Climate Change, the IPCC, the World Meteorological Organization. The World Health Organization oversees the risks of health due to climate change and proposes mitigation strategies. You must be knowing that the IPCC was awarded the Nobel Peace Prize in 2007 for assessing the science related to the climate change. So this is a recent report released by the IPCC in March 2023, which shows us the difference in increase in temperatures over decades and centuries. So if you see this graph, you would come to know that by 1940s we had around zero point 0.1 to zero point 0.2 degrees in temperature rise on the Earth's surface. In 1980s it was almost zero point 0.4 degrees, and now if you see it's almost reddish brown, and it correlates with 1.1 to 1.5 degrees increase in temperature. And if we do not do anything right now to stop it, the future is even more bleak, showing a 4 degrees increase in temperature of the Earth's surface in the next century. So the WHO is responsible for the research on human health and climate change. Next. And it is so ironical to note that what we have been thinking as development for the improvement and quality of life over the 50 years, like we've been setting up power plants, the agricultural methods, the vehicles and the transport that we are using to commute every day, the landfills, the deforestation, the felling of trees for housing and offices that we build, all of this ironically has a rebound effect and has changed the climate, and which is now affecting the health of human population. So once the Earth's surface rises, the ice starts melting. There is rising sea levels, and there is a change in ecosystem which leads to animal migration. There's increased humidity, rainfall, and there's more intense heat waves leading to severe drought and water shortages. There is change in biosphere, loss of species, not enough food being produced. So there is displacement and poverty, which leads to more health risks. So, ladies and gentlemen, I want to bring your attention to the greenhouse effect, which is one of the most important problems that causes climate change and global warming. This is because of the excessive emissions of greenhouse gases such as carbon dioxide, methane, chlorofluorocarbons, and the burning of fossil fuels is one of the most important source of greenhouse effect. And the studies that are being done show that if we start decreasing the greenhouse emissions by at least 30%, this could stabilize the global warming at less than 2 degrees by 2030. Whatever damage is done, we cannot revert it, but at least we can focus on reducing this greenhouse effect. So all the more because the World Health Day 2023 the motto is health for all. The impacts of climate change on health, the direct impacts would be extreme heat causing heat strokes and the cold impact. The indirect impacts come via the ecosystems, which include the reduction of global food supplies, changes in vector-borne transmissions, and because of the low global food supplies, there would be increased poverty and inequalities and migration. IPCC has noted that the impacts of climate change on human health will not be uniform around the world. So it would be different in India, different in other countries. So this depends on the vulnerability and the adaptive capacity of a population to the climate change. Developing countries particularly in small island states and high mountain zones and densely populated coastal areas, are considered to be particularly vulnerable to these changes. There would be increase in burden of diarrheal diseases, dengue, malaria, and other vector-borne diseases, particularly if there is a poor health infrastructure. So this slide was focused by Dr. Murray. Uh, this shows the climate-sensitive health risks because of climate change, that is the heat strokes, the respiratory illnesses because of air pollution, the waterborne diseases, the zoonosis, the vector-borne diseases, malnutrition, the non-communicable diseases, all of which could cause mental and psychosocial health problems. So these alarming facts recently in the WHO fact sheets, this shows that we would be in for, say, witness to increasing heat waves, wildfires. They would be increasing in scale, frequency, and intensity. And research already shows that 3.6 billion people are highly susceptible to health risks because of climate change. And we can expect an additional of 100,000 additional deaths per year because of undernutrition, malaria, diarrhea, and heat stress alone. And we would have had to spend 2 to 4 billion US dollars by the year 2030 to tackle all these illnesses. And particularly areas with weak infrastructure, mostly the developing countries. Let me remind you that India is a developing country with a developing infrastructure, so it would be difficult for us to cope up unless there is assistance, and we need to prepare and ourselves to respond to all such illnesses. So the climate adaptation takes place at different administrative levels, at global, regional, national, and subnational level, each having to contribute in their own way and implement strategies. So these are the WHO mitigative strategies that are suggested. We can start by start planting trees in our neighborhood, which that can improve the air quality and reduce air temperature and thus reduce heat waves. Investing in health facilities for the mitigation and adaptation and reduce the energy consumption in hospitals. It is important for us to adopt smart agriculture for land productivity so that we produce enough food to reduce malnutrition. It's important for us to invest in renewable energy for mitigating the air pollution because of greenhouse effects. We already are seeing there is a lot of change because electrical vehicles are being adopted by many of us these days, even in India. So let me tell you in brief what is happening in our country in India. This is the geographical map of India. You can see it's very diverse. We have India as a peninsula, as you can see, surrounded by water on three sides. We have the mountains in the north, the Himalayas, uh, the major rivers like the Ganga and Yamuna in the north. We have the Deccan Plateau and the Ghats, the western and eastern Ghats in the south. As is diverse the country, so is the population that is vulnerable to the climate change and the health risks. So this is from the Indian Meteorological Department, which compares the increase in surface temperature of the Earth through decades. As you can see here, there is an increase by 3.1 degrees over the previous decade in 2020. As a child, I do remember we had demarcation that from March to May it would be summer, followed June to August it would be rainy season. But these days there's no clear-cut demarcation. We do have rains in March or May, and anytime in the year we have rains, and in October and November generally it's called winter, but it's quite pretty warm even right now here. So this publication by the CDC Atlanta uh, in the Indian Journal of Medical Research is an eye-opener. It talks about climate change and infectious diseases in India, the implications for healthcare providers. We do see frequency of floods being reported, particularly in the northern India because of the glacier-like outbursts in mountainous regions. and there have been landslides because of the floods, particularly in the summer months in May. Because of the floods, the water is contaminated with human or animal waste. The rate of fecal-oral disease transmission increases, allowing diarrheal diseases, cholera, dysentery, giardiasis, salmonellosis, and all other diseases, as you can see. And stagnant water again provides breeding grounds for mosquitoes, potentially aiding in the spread of malaria and dengue. As the ambient temperatures increase, the bacterial survival time and the proliferation increases, and the incidence of diarrheal diseases again further increases. So this is a publication from India in the Lancet talking about the increase in number of dengue cases. We had a previous speaker also commenting on the increase in number of dengue cases in India. So this also says the same thing. There is an increase of around 2 to 3% every year. The number of dengue cases have been increasing. So this is a report from a nearby children's hospital in Hyderabad, in the city where I live. This is from January to October, where the respiratory infections, generally they do come in, we do see these respiratory infections during winter months, that is from November to January. But it's alarming to see them right from January to October. More than 2,000 cases of respiratory infections, and most of them are respiratory caused by respiratory syncytial virus, as you can see here. If you see the health facilities and infrastructure, there are two broad divisions: the public hospitals, which are run by the government, which are affordable. They even provide free of cost services. They're all concentrated in the urban areas. The rural areas have primary health centers. On the other side, we have the corporate hospitals, which are run on business models. They are run on business models, and they are private hospitals. They are very expensive, and they are all concentrated in urban areas. So the health delivery systems in India are not uniform to the population. So the Government of India initiative regarding the climate change has been the launch of the program called National Program on Climate Change and Human Health um, uh, in 2019. And the main objectives are to create awareness among the general population, particularly the vulnerable community, to healthcare providers and policymakers. The objective is to strengthen capacity of the healthcare system to reduce illnesses due to variability in the climate, and to strengthen the health preparedness and the response at all levels, including the national, state, district levels, and strengthening the ICUs, laboratories, and the blood banks. And it also is important. The objective is also to work with partners, with other missions, and ensure that health is adequately represented in the climate change agenda in the country, and to strengthen research capacity to fill in the gaps. So this is a publication by the National Program on Climate Change. So the National Center for Disease Control is responsible for creating awareness and behavior modification in the general population, and prevention and adaptive measures for climate sensitive illnesses. It's responsible for training healthcare personnel and equipment in the institutes so that climate resilient health services are provided at all levels, including the village and district level. Integration of and monitoring system for collection and analysis of health-related data, regulation on key environmental determinants with the check of quality of air, water, food, and waste management, agriculture, and transport. We do see boards showing how much the pollution is, the air pollution or noise pollution at that particular time, and evidence-based support to policymakers. So what can we learn and implement from other countries? The General Medical Council of the United Kingdom has proposed recommendations and actions for the healthcare providers. First and foremost, to create awareness among professional colleagues and bodies, advocating carbon emission reduction, undertaking energy audits, and pursuing energy conservation and energy efficient construction, energy efficient transport system, and contingency plans for alternative methods for energy generation. The Royal Society and the Academy of Medical Sciences have proposed mitigation strategies for health risks due to climate changes. And the net zero direct emissions by 2040 by the NHS is a very excellent example where I think India should note and follow. So, what should doctors and hospitals expect in this scenario? We must be prepared to receive more illnesses and deaths from heat strokes and heat waves, um, post traumatic stress disorders, which because of displacement, because of cyclones and floods. We should expect change in range and distribution and the incidence of outbreaks of vector-borne diseases like dengue and chikungunya, which we are already seeing, adverse health effects of severe drought and in the remote and the rural communities. We should expect to cater to all these requirements. So we must discuss all these with our patients and their relatives who walk in with them to the hospitals, encourage them to have a healthy diet, promote healthy exercise, offer them preventive health checks to prevent comorbidities. So, to summarize, ladies and gentlemen, the climate impacts in India will not be uniform because of the geographical diversity of our country, and those of low socioeconomic status, geriatric, pediatric, will be likely the most affected because of their lesser adaptive capacity. As India's economy continues to expand, the growing middle class presents a unique situation while rising out of poverty, they would decrease the infectious disease and communicable diseases, but it would also lead to higher consumption patterns that can initiate new health problems because of carbon pollution. General practitioners and specialists should play a role in anticipating health effects because of climate change and discuss with patients regarding the effective preventive health. And together we should build a better, more climate resilient and environmentally sustainable health systems. Thank you for your attention.